people are talking about Keir Starmer's new plans that are going to cut the number of people who can come to the UK to work in the social care sector. And I've heard people talk about the vacancies within social care, the crisis in social care, but there's an element that I don't think I've seen anyone talk about, and I wanted to talk about NHS hospitals. So a lot of people will know that this winter we had a terrible crisis in the hospitals, and the phrase corridor care was getting used a lot because patients were being treated in unsuitable areas of the hospital, and it was awful. I mean, it was just so awful. But what didn't get covered so much was the pressure on the beds and how social care was related to that. So there's been times over the last few months in England where almost 1 in 7 of all adult hospital beds have been occupied by somebody who's actually ready to go home from hospital, but they can't. And often that's because of the social care crisis, because they need to go home and receive care, or they need to go into a care facility, and that process is incredibly difficult at the moment. Now, what happens is in a hospital, if you've got a number of patients like that who can't get discharged from the hospital, it creates patient flow problems all the way through the hospital. So in an A&E department, it delays people being admitted into a hospital bed. And in an ambulance, if you're trying to drop a patient off at a hospital to go into the A&E department, there can be delays there as well because there's too many people in the A&E department. Things are crowded, right? So the social care crisis is having an impact all the way through our hospital systems and our healthcare system generally, because it also places pressure on GPs. So it's bad for everybody if social care isn't working properly. It's not just bad for the people who are directly receiving social care. When we look at these plans from Keir Starmer and the fact that it's probably going to result in less people coming to the UK to work in the social care industry, we need to ask really serious questions about the impact this is going to have on our hospitals, on our GP services, on our ambulance services, and what's going to happen this winter. Because we had a horrendous winter crisis in the winter just past. It was absolutely awful for so many patients and so many staff members, and we deserve things to get better, not worse. I personally feel that social care workers should be supported better, paid better, and people coming from overseas should be welcomed and supported, not sort of blamed or sort of, I don't know, being told that they're not welcome. And if you agree with that, could you share this video, because I will explain more about what's going on with the NHS. My name's Julia. I'm a doctor by background, but I gave up my medical career to fight for the NHS, and I'm here to tell everybody what's going on.